Yeah, it's right there. I can so feel it's right here. Doc, can't you just rub it real quick? Well, the other doctor, he hooked me up and he put these stim things on my back. And the other one he gave me a massage on my low back and then some acupuncture and put some cream on. Hold on a second. Think of all these different remedies and things. Open the Yellow Pages for those that have a Yellow Pages, or even Google, what's a chiropractor do? I'm not saying I'm the answer, but I want to just see if this makes sense to you. And if it makes sense to you, then maybe I may have something going on. Think of this. Every nerve in the entire body has a function. When the sperm hit the egg, the first thing is formed in the entire body is your nerve system. So the nerve system is what tells the heart what to do because it created it. And the lungs, and the liver, and the kidney, and the spleen, and your eyes, and your ears, and every single organ in the body. When the sperm hit the egg, there was one cell that was formed. And from that one cell, it split, and in 9 months, there's a baby. That was all based on nerve system functioning. Your nerves. So if there's some sort of compromise to that nerve, or several of them, in the spine, wherever that nerve is exiting and going to a particular organ, that part of the body begins to break down. That has to happen. Maybe there was a birth trauma. It's possible. Maybe there's a sports injury. Maybe there's an ergonomic one as you're sitting at work. Maybe there's a work injury, you bend over, you picked up something, and you caused the spine to malfunction, not the vertebrae. Chiropractors should not focus on the vertebrae. What we focus on is nerve system functioning, because that's what keeps us alive. Bones do not, nerves do. Think of this. If I take the hand, if I take an artery out of here, or a vein, or muscle, or a bone, it'll be alive. Not for a long time, but it'll be alive. The absolute instant I take the nerve out of that area, life ends. Life lives in nerves. Or how about this? How long can you go without eating? 3 weeks? How about water? 3-4 days typically, some people longer, right? You just start dehydrated. How long? How long can you go without air? About 3 minutes. Ideally, about 3 minutes. How long can you go without a nerve supply? Less than a second. Life lives in nerves. Every nerve in the entire body meets at the base of the skull. And when there's some sort of neurologic compromise, the brain is sending life to the body. It doesn't send cancer messages or tumor messages. So what a chiropractor does is finds out where that neurologic compromise is at in your spine, restores that normal neurologic functioning so life can happen again. That's what chiropractors do. Anything outside of that, they're adding other therapies or things to chiropractic. Not saying they're bad per se, but it's not chiropractic. So if you know if they're doing acupuncture, massage, or all this other physical therapy or functional medicine, that's not chiropractic. Chiropractic is the monitoring of nerve system functioning to ensure that the body's working the right way. And when it's working the right way, I call it getting weller. Hey, keep your head on straight. This is Dr. Eddie Weller. Have a great day.